Namaste, I'm Ashok Vyas, and I'm joined by Dr Anjana Samadder, and she is sharing the story of hope and strength, as well as sometimes while you are helping others, you end up receiving some invisible, unwanted, I am just using the word gift, for which President Trump has referred to as invisible enemy. But
Mm.
she has succeeded in fighting and staying victorious over this enemy. But first, let me welcome you and thank you for joining
Thank you
us.
so much. Namaste.
So let us begin by the day when you found out that you are COVID-19 positive and
Yeah,
how
I
that happened.
I was feeling weak and tired for a few days the previous week, and then I developed cough and fever, and then I became short of breath. So I initially just thought it was, uh, some common cold, and I just took some. Then I thought it may be a bacterial infection. Took some antibiotics and Tylenol, but later at work, I kind of became very short of breath and collapsed. And that's when I went to Ohio State University emergency room, and I guess they tested me over there, and I was COVID positive.
So let us try and walk back. What do you
Mhm.
think might have been the reason for you to have been found COVID-19 positive? And you talked about some of the symptoms, but initially you felt that this could be something else and not that.
Yeah,
So
I kind of ignored it. Yeah, I did not take it very seriously. So my request to everyone is, this is a serious disease, and if you have any symptoms, get it addressed right away, and don't take it lightly. Definitely not.
So what did you do initially? You took normal medication, and I believe that helped you in subsiding the impact of COVID-19 initially, and you felt that everything is fine. You were going about your work.
Absolutely. I took Tylenol and I started some antibiotic augmentin, and I felt fine. So I went and continued doing my work. But uh, on the Tuesday, I felt very short of breath after I finished a couple of cases. And that's when, literally passed, I was collapsed. That's when.
Uh,
So,
very very tough situation to be in, and
oh,
how many days you think it took for your family members to figure out that this is what it is, and then the course of the medication was changed?
yes. I was feeling weak and tired for several days. So, and then after that, later on, I developed fever and cough. And later, when it became bad, I became short of breath. So it just did not happen overnight. It took a few days to happen.
So such a lively person when finds herself in a situation that you have to be admitted to the hospital,
Yes.
that's not, of course, a nice feeling, but you realize what has happened, and you are aware how the treatment is proceeding. Talk to us about your experience of being in the hospital.
Yeah, initially when I went, they tried to not intubate me and put me on high levels of oxygen. And I think for more than 24 hours, they tried without intubation. But after 24 hours, they had to intubate me. And after that, of course, they put me on medications to put me to sleep, all kind of medications. And then I have no memory of what happened till I woke up, almost 4 weeks later.
Oh my
And that's when I heard that I was placed on ECMO, which was placed on the seventh day. And as per the ECMO chief in Ohio State, he said that after 7 days, it does not really work that good. So seventh day, It was just at the last minute that they put me on the ECMO. They also gave me plasma because in Columbus no one had received plasma, so they were not. The university did not want to give me any plasma, but several people got involved, and they were able to get it checked out and screened in Indiana and bring it back. And the plasma was given to me by one of the ER physicians at Ohio State University. And I believe they also threw other kind of medications like the cytokine suppressing filter is in the ECMO, and I think I got steroids too. So I think I was given all the medications and all the treatment at the appropriate time, at least at the which was I was very lucky that way, even though there were a few complications while they were placing the ECMO. I coded during that time. I found out later for 40 minutes, and they had to revive me by manually doing heart compression, the cardiothoracic surgeon. And when I woke up after that, my recovery actually took place pretty good, as per them. I did have a few, infectious causes for which I was on antibiotics for a while. But, I do believe that your strength of mind, and if you really want to do it, you can. Everyone has hope. It's just that you have to push yourself and think, I can do it, and you'll be able to do it. And that's what I was determined. When I woke up, I was determined that I was not going to lay around and let this disease take over me. I was going to fight it, and I was going to stand for it. And I started my physical therapy or occupational therapy right away. And even though there was pain in some places, I said I will overcome it. So I would I would tell everyone that have hope, and it is a determination. Don't give up. You can fight this disease. Absolutely.
So I really want to appreciate you, and
No, I
I
appreciate
want
it.
to thank. It is not just you said that you were lucky. I think we all are lucky that that determination and the way things unfolded with right type of medication at the right
Right.
time. But let us, if you permit me to take you back to the day when you opened your eyes in the hospital after 4 weeks.
Absolutely.
But you were still in hospital for further couple of weeks, I think.
No,
And
I was 2.5 months, almost 3 months, I was in the hospital because they had to put me on trach, and they had to slowly extubate me even though I was awake. So they were not sedating me too much at that time. And then after they did that, I developed some infection, and so they had to keep me. And then the process took more than 65 days. I was in the hospital. Yes.
so we talked about plasma therapy, and you were the first one to receive that therapy. And
Columbus,
I
Ohio.
believe your husband also worked with system so that it happens. And along with the medication, it was the act, act of prayers and sustaining that sense of hope and determination. So on that front, while you are weak, it sometimes becomes difficult to pray. Or how would you say how that was playing out?
Yes, all my friends, and I'm part of the API community, which is Asian American physicians, and a lot of them I wasn't able to look at the WhatsApp, but they were praying for me on a regular basis, and their prayers, good wishes, for which I want to thank them too, and the determination, I think, brought me back. So I would not give up. I would fight it. I would pray. And, this organization has been great to me. They actually all jumped in and helped with this plasma and this ECMO and everything. Everyone was on top of everything. And they worked as a community. It was a team effort. It was just not one person's effort.
I may also add here that speaking to you from ITV Gold and chairman of ITV Gold, Dr. Padma Shri Dr. Sri Parikh was also concerned, and
Absolutely. And he was
he would.
part.
he was very very happy that things turned out the way they did.
And he was part of my the prayers and good wishes. So I would like to thank him too. So it's all the friends and family, their good wishes and prayers, I think, brought me back.
And now let us take the advantage of your strength for those who are either facing, or if unfortunately they have to face that one of their family member is suffering, or uh, someone who is in this state uh,
Right.
where they are fighting, your suggestions for them.
My suggestion would be, first, don't take this disease lightly. If you get any symptoms, not just fever, weakness, tiredness, contact your physician right away, get checked out. And after that, I would also say that the family and friends should be involved with the treatment process and just not leave it. I mean, the physicians are doing a good job in the hospital, but I think family has to be, and friends need to be involved with the treatment process and be on top of things. And the last thing I would say is, don't give up. Have the determination. If I made it with all the complications, and I do believe others would make it too, because I was told by a lot of people that I was not supposed to live, and I made it. So if I can do that, I'm sure the others can do it too. But involve the family in the treatment process and be on top of things.
Thank you very much for those
Thank you so much.
encouraging and words full of strength and inspiration. And you remind me that life is glorious, and the beauty of,
Absolutely.
absolutely, and the beauty of life and the glory of life needs to be respected by sustaining hope, courage, strength, and 9 weeks of staying in hospital, being the first one to receive the plasma therapy, and opening the pathway for others to follow, so that the correct treatment at the right time may help them. So, thank you very much for joining us, Dr.
I
Anjana ji.
appreciate your
Lots and lots
letting
of
me.
good wishes.
Thank you so much. Bye bye.
So, my guest, survivor, and a source of hope for us, Dr. Anjana ji, thanking her and thanking all of you for being with us. Namaskar, I'm Ashok Vyas, and this is an occasion where we all feel that the ray of hope and a collective fight to overcome the challenges posed by COVID 19. How Dr. Gautam Samadder and his wife, Dr. Anjana, dealt with it. Uh, I must admit that love manifests in several ways, and one of them is that neither you give up nor you want others to give up. And to tell us more about how Dr. Gautam faced the challenge when it was discovered that his wife, who herself is a physician, and she got COVID 19 as she was dedicated to serve her patients, and in some invisible way, as this attacks everyone or those who get attacked. So, talk to me, Dr. Gautam, when did you realize that these symptoms are leading to COVID 19 affected state?
Thank you, Ashok. Let me brief you how this whole episode started. Anjana started having symptoms of cough and shortness of breath, not that much, but fever at night. On a Friday, she was admitted to OSU on April 7th. So around 4th, 5th, she started having symptoms. So as you know, we are all doctors. We keep antibiotics at home. So we thought this is simple bronchitis. So she started self-treating her self with amoxicillin. And at night when she had fever, she took Tylenol. So that subsided the fever. And if we go back, I think that was the biggest mistake we did for undermining COVID. And as you all know, we all were aware this COVID, but nobody was taking it very, very seriously. She went about doing, she is a GI specialist, so She was doing scopes with precaution of wearing a mask and things like that. But the real screening for COVID, which is happening right now, was not there in month of March. So she started having cough, and over the weekend, especially on Sunday, she was very short of breath. And I was not at home. I was driving with my son to Chicago. So she called me that she's short of breath. So I said, "You call 911 and go to the hospital." But instead, she took Tylenol and amoxicillin, and I came back at night, and she was not short of breath. So then next day on Monday, she went to work and she did not have any shortness of breath. And this is one of the tricky thing about COVID. COVID symptoms sometimes subside and you are a normal person, and then it hits you really bad. So that's exactly what happened to Anjana. Monday she was fine, no shortness. She did 24 procedures in surgery center, and then at night she came back. She didn't have any fever. Then she went to work on Tuesday, that is April 7th. And after doing 2 procedures, she suddenly collapsed in the surgery center. Her oxygen was only 70%. So I was in the same building upstairs in my own clinic. So the nurses called me, and I just put her in the car and drove to OSU emergency room. As we were driving, I knew the people who were in the COVID team. One to mention was Dr. Sonal Pannu. She is in the international COVID team in working uh, as OSU pulmonary division. So she had all the paperwork ready for Anjana. As soon as she landed in the ER, she was whisked to the ICU. And that's the first time we came to know that Anjana is COVID positive when they did the rapid test. So at that time, no guest was allowed. So I was not allowed in the hospital premises. I came back and I took my son, my daughter, and my mother in law for COVID testing that very day. And unluckily, we were all positive except my mother-in-law. And the reason mother-in-law was saved because she had a separate room and she always used to wear a mask and she never used to come down and mingle with us. So she was negative. So what I did, first thing I did, my brother-in-law lives in Pittsburgh. So I had a car arranged, Uber for her, and I sent her straight away before anything happens to Pittsburgh. And then we all took hydrochloroquine and Zithromax. We got it prescribed, and we were fine except Anjana. So Anjana's course, and also in the surgery center where she was doing endoscopy, her nurses and office staff all were positive, but none of them got sick like Anjana. So now the main question we ask, why out of all COVID positive, why few of them get sick and they are put on ventilator and some of them unlucky ones die? So with Anjana, we are finding out that A positive blood group are very, very susceptible for that because Anjana has no medical disorder. She's not on medication. So there is no reason for her to go bad. So when she was admitted, her chest X-ray was all bilateral, pulmonary edema, infiltrate. So she survived only one day without ventilator. On April 8th, I got a call that, hey, she's not breathing well. We have to intubate. And that time there was a fear that patients who are put on ventilator, their course is very bad. They are eventually dying. This was the report coming from New York, where you are. So I was very hesitant to put her on ventilator, but the way she was breathing, there was no other choice. So before intubation, she called me that she's very sick. God knows she will come out of that, and everybody in the family was panicking. So she was eventually ventilated, and then she was on ventilator for at least 7 days. Now there is a new protocol that anybody who is not doing well on the seventh day of ventilator, they are put on ECMO. ECMO is a device where you give lung a rest and you ventilate your body through a ECMO machine. This is called artificial ventilation. What it does, it takes out the pressure from the lungs and gives lungs rest, but the body is getting oxygenated. And that worked really well for Anjana because, as you know, there are other unfortunate people. One person is Dr. Ajay Loda in Mount Sinai. He was not put on ECMO, and eventually his lung had bilateral fibrosis. So to prevent that, ECMO is a very good, alternative. So she was put on ECMO, and unfortunately, while putting the ECMO catheter through the neck, the surgeon accidentally perforated her right heart and made a small hole, and she had a cardiac arrest right in the OR. So they detected it very quickly. In 2 minutes, they opened her chest and did a open cardiac massage. So that cardiac arrest lasted for about 45 minutes. So as a family member, we were all worried that if somebody's cardiac arrest lasts for 45 minutes, what will be their mental status when they recover? So luckily, with God's grace and everybody's prayer, there was no change in mental status because her oxygen did not go down. And then her chest was closed after 48 hours. But then her next complication was COVID. Patients have a lot of blood clots going all over the body. So she developed a big clot in her left hand, and the way they found out was she lost pulse in the left hand. So they did all the imaging and found out that there was a clot in the ulnar artery. So since the chest was open, they had to do an embolectomy at the bedside. Usually, this embolectomy is done in the OR where they find the right artery where the clot is. It was done, and the pulses came back, and then eventually the chest was closed. Then what happened? Because first of all, she was COVID positive, so she was in isolation, very limited nursing care going in and out of the room because it is a negative pressure room, and the whole hand was dressed from top to bottom, so nobody was checking what was happening under the dressing. So she was unfortunate to develop hematoma where there was the surgery site embolectomy, and hematoma is a big blood clot where you do the incision. So what happened, that hematoma started pressing on her forearm muscles and damaged the forearm muscles and the nerve and the biceps. So this was detected after about 8 or 10 days, with her hand having a lot of blisters. And then they had to take her to the OR. And this thing is called compartment syndrome, where the blood clot is pressing on the forearm muscles, and that compartment gets high pressure. So the muscles and the nerves beneath that get damaged. And that's exactly what happened. So all those muscles, necrotic muscles, were taken out, debrided. So she had two surgeries to take out the forearm muscles and some of the bicep muscles. And then luckily, a doctor named Amy Moore, she's the head of plastic surgery. She headed that whole surgery, and she's still taking care of Anjana. So these two complications related, one was iatrogenic, that means surgeon accidentally did it, and one is COVID-related clot, where the main handicap for Anjana, and that made her stay in the hospital for 63 days. So luckily, COVID-related pulmonary complication was not there, but other complications of COVID led to her stay such a long
Yeah.
period.
Dr. Gautam,
So
let me interrupt you just to bring some of our viewers to the reference that we are talking about. And I once again want to thank Dr. Gautam Samadder for joining us. He has been very active with the community as president of API also. His wife has also been active. And the situation has positive and negative both. Positive, of course, Dr. Gautam knew exactly what needs to be done with his wife, Dr. Anjana, as well as with other family members. They got tested. And later on, this situation, which Dr. Gautam describes so well, many patients who are not familiar with the medical side of it are left in dark. They don't know what is happening. Partly that was the situation with Dr. Gautam also, because uh, there is a needle and there are some additional wound which a patient who is already weak has to undergo and suffer. But what I also want to appreciate is the composure, the collectedness, as well as a sense of strength and conviction with which Dr. Gautam faced this challenging situation. Unfortunately, as we are in a position to talk about it as a success story, for that, indeed, we always say God's grace. And also by grace, the correct thought coming at the correct time. And I once again want to appreciate Dr. Gautam for being on the top of it to the best of your ability. And now let us uh, move to the other reference. Once you are on the ventilator for such a long time, and at that time, I believe the plasma therapy was not that much prevalent. And in order for that to happen to Dr. Anjana, you had to sort of leave no stone unturned, including making calls to congressmen and governors, etc. Talk to me about that side as well as anything else that you feel is relevant.
Yeah, so that was the next phase in her treatment. Uh, we were seeing a lot of patients dying on ventilator in New York, California. So at that time, plasma was just kind of a research tool. So we started looking for plasma, and we got three donors. Two from Columbus, one from Dayton, Ohio. We had a massive campaign, and the Columbus community and Ohio physician community, they really helped me a lot. They sent messages to everybody that who wants to donate. But the problem, the red tape was Red Cross was not prepared to give plasma, especially in Ohio and Columbus OSU department. So we had to look for other alternative arrangements where this plasma will be processed. So we found an alternative, but they did not have the plasma screening facility in Columbus. So that plasma had to be sent to Indiana for screening. And when talk about screening, is you test for HIV, hepatitis, and all the other infectious components, then that plasma can be given. So that process took about 2 to 3 days. The blood sample going to Indiana and then coming back. So we were all very scared that each day was passing by. We are counting this, that what will be the status of Anjana. So luckily, on the third or the fourth day after the plasma was given, it came from Indiana on Monday and it was infused. And she was the first one to get plasma in OSU, and that was a big deal. And that opened a floodgate for other people getting it. So I'm very, very happy that she got the plasma at the right time, and that uh, produced antibodies, and that's where her infection started getting controlled. So in 48 hours, we saw a huge improvement in her symptoms, and then her ventilator status improved. So I think plasma played a major, major role in Anjana's recovery in quick time.
And Dr. Gautam, once again, I want to thank you for sharing this story and look at it from the point of view of family members who have such a situation that one of the family member is found COVID-19 positive. What would be your advice in what way they should deal with the challenge posed by this situation where they don't many times have access not just to their family member, they don't get complete information as to what is happening. So what are the various steps which you can recommend someone should take?
First thing, the family members uh, they should not give hope. They should give 100% try. They should do research what is going on with COVID treatment. Everything is available in internet. They should be well informed that at each step what to do. And like what I'm saying, once a patient is admitted, is on the ventilator, they are now using steroids. Then if the lung is not getting ventilated 7 days, they should take the patient to a facility which has ECMO. These research should be done, and then every day I used to communicate with the doctors in the morning after the rounds and in the evening, and they should be in touch with the physician group, and they have every right to be in touch because the guests are not allowed in the hospital. So best way is to communicate with them with phone or in Google and be on top of that. Never give up, because once you give up, then the battle is lost. And once the physician team, the nursing team knows that the family is on top, they will be very, very careful and not just let the patient die. So since Anjana's condition, a lot of improvement has taken place. There are a lot of new drugs which are being used, and you will see the reports, less people are getting on the ventilator. So that's a positive move. But still, if your loved ones is admitted and they are sick, they should be on the top of case. And also, uh, even if you are not sick, if you are COVID positive, or if you are coming across a patient who is COVID positive, you should be tested right away, because right now what we are seeing is that there are a lot of asymptomatic patients. What that means, that you get the virus but you are not short of breath, you're not coughing, you're not having fever, and these are the dangerous carriers who are spreading the virus in the community because they are not aware that they have it. So my advice to everybody is, if your loved ones are suffering, or if you are exposed, you get tested for COVID and be on the right treatment, and not take this. Some of the people, like Anjana did initially, that she thought this is just bronchitis or flu, and not to take that so lightly. This is very, very dangerous. COVID is manifesting in a lot of different ways. When Anjana was admitted, there were 2, 3 patients whose leg and arm got amputated, and I'm very lucky that we saved her arm and fingers. But blood clots are very, very common. People are having strokes, heart problems. So, and another big symptoms which some of the RP members had is you have extreme fatigue. You may not have cough, but suddenly you start feeling very, very weak and fatigued, and that is one of the common symptoms we are noticing in COVID patients. So be very, very well educated with COVID symptoms, their symptoms. Look in Google, internet, everything you know about COVID, you should know. And as far as the treatment is concerned, make sure that hospital where your loved ones are, they get the best treatment available in that facility.
Dr. Gautam Samadder, I really want to thank you for sharing all the details, and only you could have conveyed this process in such an articulate and well informed manner. There's another side which is not related to you being a physician and being an expert, and that is being an emotional being. Uh, to be able to sustain emotional strength also requires some effort or some internal work. Would you share how did you cope up? How was it for you to stay calm and composed and focus on the next step that needs to be taken, and not allow yourself to go down internally and sort of lose hope? So, sustaining hope and sustaining emotional strength, what would be your tips, especially with reference to these kind of situations?
So, it was a unique situation with COVID. None of your friends, family members can visit your house. People used to come and drop the food outside and pick it up. So that was a big help. But the way I coped up with, one of my sister is involved in art of living with meditation, with Sri Sri. So I attended a 3-day course, and I started doing yoga and meditation. And then, of course, a lot of prayers. I used to pray morning, evening, because every day was a unique day. In the morning, if I hear a good news, in the evening there is a bad news, and this was the only way I could maintain sanity, was prayers, meditation, and just motivate myself that there is light at the end of the tunnel. And that was a very unique experience for me. uh, and So my advice is that when you have this kind of unique situation, you have to start believing, spiritual, uh, spirituality, meditation. These are will be very comforting to you, rather than just be very sad, because sad and getting depressed is not going to solve this problem. This infection will take its eventual course, and if they are in the right track on the right medication, the patients will be good. Now, I just heard that there are 2 3 patients in US whose lung was damaged are getting lung transplant. So before they were not doing lung transplant on COVID positive patient, but that's another thing you should explore. If your loved ones are going through a phase where their lungs are damaged, look for centers where lung transplants are taking place. Cleveland Clinic is doing lung transplant COVID patients. Ohio State University is doing. So look for places, do the homework and research ahead of the game. So when that stage comes, there is no time lost. So that will be my advice to everybody watching this show, that uh, do research and be ahead of the game rather than be dependent on the physician team or the nursing team which is taking care of your loved ones.
So, Dr. Gautam, I want to thank you for sharing all this, and I also recollect with you. You mentioned about Dr. Ajay Loda. We hope things turn towards the positive side. I believe he may need lung transplant, as we hear. Um, Again, we keep our fingers crossed and pray for things to move in the right direction. And also, I want to bring to your notice that our chairman, Padma Shri Dr. Sudhir Parikh, has not only been active member of, or rather, the early founding team member of API. He has also seen that a bridge of proper information through media and print as well as ITV Gold is continuously developed so that people get the right information. And if you would like to say something about your interaction with Dr. Sudhir Parikh related to facing the challenge of COVID-19 and his role in particular in this regard.
Yeah, and Dr. Parikh is a good friend and kind of a mentor. He's much senior to me in API. So he has been already always in touch with me about the progress of Anjana. And what I liked about Dr. Parikh through the media, because education is very, very important in this. Because when COVID started, nobody knew what this disease is, whether it is a virus, bacteria. Now people are saying it may be a bacteria. So there is so much was unknown, and media is a very good way to educate the people, because a lot physicians, have access to journals and others, but common non-physician, they rely on the media. So right information, the way it is put to the people is very, very useful. And I think Dr. Parikh, and through your channel, a lot of people were getting very good information, very valuable. And these type of patient experiences and family experiences are very good. This raises the hope for people. They don't think they are lost, because we did lose a lot of RP members or physician during the early crisis, and I don't want to mention their name, but it was very, very traumatic. So there was a sense of fear. If a patient is admitted in the hospital, the first thing people think, they are not going to make it. So these type of interviews, these type of interactions are raising the hope, and people will have a second chance that yes, even if they are admitted, there is a chance that they will come out alive. So that's the message. I think your TV will be very, very helpful in spreading that message, and that's what Anjana wants, I want, because I am one of the people who suffered during these 2 3 months. So that will be my message to everybody, that don't lose hope, try your best, and do everything what is possible for your loved ones.
Thank you very much, Dr. Gautam Samadder, joining me, sharing the ordeal of his wife, Dr. Anjana ji, um, mm, being found COVID-19 positive, and then all that happened. But fortunately, the plasma therapy and sustained consistent efforts on the part of our will, as well as on the part of family members, brought us to this stage. Once again, good wishes for speedy recovery. Even when you come back home, it takes time in gaining all the strength, and there might be more people who would hear it and would also have a sense of hope with them after this conversations. Once again, thanking you for joining us. This is Ashok Vyas.